Hey, Dr. T. I had two really good, interesting Essure cases today, and two reasons why I think you need to consider having your removal done with a physician that has really spent a lot of time doing these cases, because even in hands that have done a bunch of them, like mine, where I've done 800 or so of these removals now, you're going to see some weird things. And I had something happen today. I had two cases today. The first one was just a pretty straightforward case, a patient that wanted a salpingectomy. As you are aware, salpingectomy is where you remove the coils from the fallopian tubes. But this particular patient, and I'm going to show you real quick, had a really interesting kind of case, because if you look at this first one, her tube is coming off here. This is the right side, and you can see, it kind of pokes out a little bit. The bleeding is from where I injected it with the medication so that it wouldn't bleed. It's not, the deviation there, whether or not this is causing her pain, debatable, but I took the coil out, and the interesting thing is that when I took it out, I always tell people to do an X-ray. You should do X-rays before the case, so you can make sure that you only have two coils and that you know exactly where they are. But you should also do an X-ray during the case, and I'm going to show you why. The reason that you want to do an X-ray during the case is because, and I'll show you, you can see probably this little black dot right here. So this is her pelvis. I'm not going to go up too high because I don't want you to see her name. But there's a little black dot here on the X-ray. That little black dot is a piece of Essure. Now this is after I removed what I thought was the complete coil. And this lady has this little teeny speck. Now I could say, oh, that little teeny speck, that's not a big deal, we'll just leave that alone. Well, let me show you what that little teeny speck actually was. I went back in and I did the case. And when I went back in, this is what I found was still left behind. That big of a piece was still in her uterus. I had to go back in and I cut the uterus back open because I saw this tiny freaking speck right here, and that's the piece that was left behind. So even with somebody that's done hundreds of these, you can still have a little piece, what I thought was a little piece break off, and when I went back inside, it wasn't a little piece, it was this big massive piece. Then I did the X-ray again, and there's no speck. It's all gone. So even in expert hands, you can still get these little specks, which turn out to be these big chunks of coil. So case number one, case in point, X-ray, X-ray, X-ray. If you've had a salpingectomy, if you've had your tubes removed and you didn't get an X-ray during the case or after the case, demand one. Get an X-ray, because you never know what could be left behind. And even in cases where you have somebody that's experienced, if they tell you they've done hundreds or they've done 100 of these, but they don't do X-rays, how do they know they're removing the entire piece? Second case was a lady who had Essure removed. She had a hysterectomy and she had her Essures removed. She had a salpingectomy first. They didn't actually remove the entire Essure. So then they went in and did a hysterectomy. They didn't do any X-rays at all after the hysterectomy. So the X-ray on this lady showed that she still had a piece of one of her coils left behind. And I'm going to show you, because that's my ceiling, not my picture. So this lady has a little piece of Essure on the left side. This black line up here is just a part of her bone, but that little speck right there is an Essure, a piece of the Essure in her pelvis that was left behind. So she's had not only a salpingectomy, she went back in and had a hysterectomy because she didn't have the entire Essure removed. Even after the hysterectomy, they didn't remove everything, and I'm going to show you why in a second. So this poor lady's already had a couple surgeries, and now she's having her third surgery because it didn't get removed right the first time. On top of all of our intestines is something called the omentum, and the omentum is a fat pad that covers the intestines, and it basically covers things. I found the piece of this lady's Essure in her Omentum, and this is a picture of the skin. What I did was I cut out this piece of fat inside of her belly, and that's the Essure piece inside of the fat. I have a picture of it that's actually on my phone that I will put on this post so you can actually see what this looks like in real time. So two things. One is, both of these cases happened to these women because X-rays weren't done, either before or during the case. Here's the deal, and I posted something about this in my private Essure group. And if you want to be a part of my private Essure group, just type in Tassone method on your Facebook search page and join the group. We can talk about things there a little bit more freely. But if you're having just a salpingectomy, and I know I sound like a broken record and people have gotten mad, but you get one shot to do this the right way. And there is something that comes with experience. There's something that comes with doing this a bunch. You saw in the first case how even somebody that's done hundreds of these can have a piece, a small piece that I thought was a small piece, break off, and I do the X-ray before I leave the operating room, and I do that for a reason, because those little pieces can get left behind, and it turned out it wasn't even a little piece. So what you need to understand is that doctors that cut and pull, they're maybe doing you a disservice. So a couple of things is, whenever you're having the salpingectomy, ask the doctor, do you do an X-ray during the surgery? If they say no, find somebody else. Thank you very much, find somebody else. If they don't do an X-ray beforehand, how do they know how many coils you have in there? Most of the time it's 2, but I've seen 3, 4, and up to 5. Not very common, but how would they know that if they don't even do an X-ray? And how would they know exactly where it is? So if your doctor is saying they know what they're doing with the salpingectomy and they're not doing an X-ray before the surgery and an X-ray during, I don't think you're doing yourself a favor, and you're basically gambling. And if you like to gamble, go ahead. But you get one opportunity to do this, and you get one opportunity to do this the right way. So in both of these cases, the reason that these women potentially had issues or had issues was because they either didn't have an X-ray, should have had an X-ray, and on the lady that I removed, I did the X-ray, and there was a speck there, which I could have blown off and said, well, you know, it's just a tiny little piece. But it ended up being a bigger piece in real life, and it's because of the angle of the X-ray, it just didn't show up. So make sure you do a couple of things. When you're going to have a salpingectomy, ask the doctor how they remove the tubes from the uterus. I had a lady respond to that question the other day. Oh, he's using a camera. Okay, well, they're all using cameras. That doesn't mean anything. How are we removing the coil and the tube from your uterus? Make them draw you a picture. If it shows anything cutting the tube open and pulling, cutting the tube off of the uterus, it's my opinion that that's not a great procedure, and you're going to be leaving yourself wide open for pieces being left behind. I think the best way to do it is to cut around the coil down into the uterus, all in one piece. Secondarily, there's a lot of women out there in one of the neighboring states that I won't mention that are paying cash for this procedure. You don't have to pay cash for this procedure. It's covered by insurance. If doctors are telling you there's some special doctor fee or something along those lines, it's because they don't take insurance, or they don't want to take insurance for this surgery. You shouldn't have to pay for it. It might go towards your deductible and it might be a copay, but your insurance will definitely cover this procedure. So insurance, X-ray, 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 ask them to draw you a picture. Dr. T out.